Now I would like to talk about the exercise for the lower back pain. Mostly we'll be starting from the prone on elbow to prone on full version, that is prone on your hand. So if the person is telling, if a person is having an extension pain, you have to give the opposite movement, that is flexion movement. If the person is telling you have a flexion pain, then you have to give the extensor movement. The exercise to increase the strength of the back extensor are often performed in the prone position to take advantage of the resistance that is provided by the gravity. So raising an arm and leg simultaneously increases the compression by 1000 Newton and upper erector spinae muscles level by 30% compared to the single leg extension in the hand and knee position. So this is the starting position what we are going to start with the exercise. Then we will be progressing it to a one hand alternative hand position, that is raising an arm and leg simultaneously, that is alternatively right arm and left leg as well as left arm and right leg. So when we'll be having the lowest load, when you are just activating the hip extension without a lumbar arch. Sorry, here the lumbar arch is there, but make sure this lumbar area should be flat. This is the area where your vertebral body will be getting the lowest load. So this can be a perfect example if you want to strengthen your hip extensors. Then we will be going ahead with the quadruped bilateral, that is a left side arm and left side leg, then right side arm and right side leg, that is simultaneously we will be raising. So here it is perfect. If the back is straight, then you don't have to worry. The very less amount of action will be created over the lumbar area. The right erector spinae and the contralateral abdominal muscles were activated during the single leg extension to maintain a neutral pelvis and the spine posture and to balance the internal movements and lateral shear forces. So only the single leg extension exercises are performed because the lumbar posture is more neutral and compression forces are relatively low. That's what I explained. Here almost everything is neutral. Now the scientists recommended that the exercise in which the subject raises the upper body and legs from a prone lying position never be prescribed for anyone at the risk of lower back injury, because during this exercise there are more chances the compression force can go up to 6000 Newton. The extremely high compression force are result of a bilateral muscle activity when the spine is hyperextended. So that's what you have to make sure. Spine should be in a straight position. In this posture, the facets are subjected to high loads and interspinous ligament is danger of being crushed. So now we are going to discuss about the flexors, that is abdominal muscle activation. Trunk sit-ups and curl-ups are often performed as a method of abdominal strengthening. The McGill measured the compression force during this task with both the knee bent and knee straight. He found the compression force approximately 3300 Newton without much variation between the types. And the McGill suggested that given the large compressive loads, most people, let alone those who have sustained injury to this area, should not perform sit-up of any type, because there are more chances more compression can occur when you are going to the sit-up position. So I think for today this much will be more than enough. We'll conclude the class today, and if you have any doubts you can ask and we can discuss furthermore. Thank you.